Hi, my name is Seba Bunjaku and I'm the Director for International Business at Surgical Science. Today I will be giving you a virtual demonstration of our endoscopic simulator, EndoSim. It's a state-of-the-art virtual reality endoscopic simulator that helps to improve a rich and immersive multisensory training experience and helps to improve the proficiency and confidence for your trainees, ready for the first patient. How are trainees trained today? Are they getting consistent training? Are their skill set at an appropriate level? And is today's training time-consuming and also very expensive? This graph here shows the learning curve for a typical trainee. The role of a simulator is to shorten the time it takes to be trained in fundamental endoscopic skills, such as navigation and scope handling, reducing the amount of training performed on patients and also making better use of supervisory time, helping you to develop more skilled and confident trainees. EndoSim is used in training around the world, allowing nurses and registrars to familiarize themselves with the scope and its movements at their own pace without any risk to patients. You can use simulation to reach technical proficiency more quickly and help trainees to feel more comfortable and confident when examining their first patient. So, let's get hands-on. The EndoSim comes with the fundamental skills module, a portfolio of well-defined training exercises, where you can learn how to rotate the scope, function the buttons, and use the angular controls. You can learn to visualize the upper and lower GI, insertion and withdrawal, inspecting the complete lumen. Here's one navigation exercise, which trains the combination of insertion, rotation, and tip control. I started quick and easy, and here we go. Move the scope towards the target so it fits the yellow circle. This exercise is all about mastering the scope and movements so that you have it in your muscle memory before you see your first patient. Then we come to the results. After each exercise, you can get your feedback in a scoreboard. It is digitally recorded with detailed metrics and statistics, providing both immediate and long-term skill development in medical endoscopy. In this case, I can see how much I have moved around with my scope, read outs, and time, of course. If I click on the replay button here, I can review what I did with my supervisor. You can also see your progression and track your learning curve. In the therapeutic skills module, we have polyp snaring, where you use a real tool inserted in the scope. Other fundamental exercises include learning to retroflex, mucosal examination, and managing loops. The fundamental modules allows the trainee to practice again and again, with the option to add different difficulty levels, scenarios, and complications, making each exercise unique. Now we'll take a look at the EndoSim procedure modules. This is where the trainee can learn to master the key elements of a complete endoscopic procedure and help them gain confidence and proficiency when scoping their first patient. So, let's start with the upper GI endoscopy module. We have a set of scoping exercises with the standard examination first, and then probing exercises to learn how to carefully position a tool before findings and biopsy cases. I pass through the mouth and advance into the throat. As I reach epiglottis, I can feel the resistance due to the haptic feedback, and I need to wait for the patient to swallow before I can proceed to the esophagus. Now in this exercise, I'm supposed to examine the digestive tract and make sure I don't miss any findings. A great advantage of digital simulation is to see yourself from the outside and get a fundamental understanding of how manipulation of the scope and the tube transfers to the tip. You also see how the complete tube responds to your twistings. Now, when I do the D2 maneuver and straighten out the tube, I see how the tip goes a bit further down beyond the major papilla, which is as far as I want to go. Here's something, it is one of the findings. The good thing here is that with EndoSim's randomization feature, these findings can be in different places every time you train. In addition to the standard upper GI examinations, we have the endoscopic retrograde cholangiopancreatography, ERCP, one of the most challenging endoscopic procedures. This model offers training in ERCP in a realistic environment with focus on the cannulation of the bile duct. You can train on safe navigation with a 90-degree camera side view up to duodenum and cannulation through papilla water into the bile duct with the help of X-ray. EndoSim ERCP features a split screen for simultaneous display of endoscopic and fluoroscopic views. Introduce guide wire and penetrate common bile duct. Next area to look at is the lower GI. And here you see it is very easy to switch between scope tubes, and we are ready to go. I make sure to have lumen at all times using the air button. Intubating the left colon here. To help understand what I'm doing, I can turn on the scope guide here. And now you can see a loop starting to form. Frequent withdrawal movements help avoid this looping. And here we go, loop resolved, and we continue towards the cecum. When intubation is completed, it is time for withdrawal and examination, as in this exercise where you don't want to miss anything behind the folds. With the EndoSim Simulator, you also have the bronchoscopy module. Airway navigation, either full tree examination or specific segments, as well as foreign body removal, bronchoalveolar lavage, and cytobrush management. As an instructor in the admin mode, you can create your own curriculum for your hospital, manage your trainees and follow their progress, as well as setting your own benchmarks and pass-fail levels. There are many more reasons why you should choose the EndoSim Simulator. We offer 24-hour support, training and maintenance. We offer annual updates with new features, modules and software. If you would like to know more, please contact one of our EndoSim specialists or go to our website.